speakers' remarks. And we'll begin with Governor Ige.
Thank you for joining us this afternoon. I think we all know that COVID-19 isn't going away. In fact, case counts are increasing, and the experts expect that COVID will be with us for the foreseeable future. Our response must transition from emergency response to disease management, and that's where we're at. As part of the transition, COVID will be handled more like other diseases, something healthcare providers diagnose and treat. The Department of Health will continue much of the work that has helped us have the lowest case counts per capita and amongst the lowest death rates in the nation. The department will perform whole genomic sequencing to look for new variants. We will continue our surveillance system, which I believe is one of the best in the country as well. The department will further develop its COVID wastewater surveillance program. We do know that that gives us early insight, and everyone is tested as part of that program. The department will continue to issue guidance at keeping people safe and schools and businesses open. Again, COVID will remain with us, and we are transitioning to address current conditions. We do have the tools to limit severe disease and its impact on our community, including safe and effective vaccines and highly effective treatments. We are not planning to impose new mask mandates or vaccination requirements. At this point in time, we will continue to evaluate the situation and take actions as required. But we all must remain smart and careful as ever as we transition during this pandemic. Dr. Libby Charr will be joining us this afternoon with state epidemiologist Dr. Sarah Kemble, here to talk about COVID trends and how we can help control and manage it. We also have Superintendent Keith Hayashi, who is here to talk about how schools can help protect students, teachers, and staff as the school year draws to a close. We do know that we want to maximize learning opportunities for our students, for them to continue to learn in person. And I think all of us are excited about graduations and being able to get to in-person events in some fashion. Each of us must play our part in the state's response to managing COVID-19. We all know what works. We all know what we can do to help fight against COVID-19. Stay at home when you are sick. That's the number one rule. We know, isolate, wear a mask indoors and in crowded places. Get tested if you're exposed or if you become symptomatic. Get vaccinated and up to date, boosted if you're eligible. We do know that all of these actions help to slow the spread of COVID-19 and will help to keep our community healthy and safe.
Thanks, Governor. Our next speaker is Dr. Libby Charr, Director, Department of Health.
Hi, good afternoon. As Governor Ige mentioned, we are transitioning from emergency response to disease management, where COVID is handled more like other diseases. We have three main goals we are following, and this mirrors the national plan as well. So first is to protect against and treat COVID-19. Second is to detect and prepare for new variants. And third is to enhance community resilience. So with regard to protecting against and treating COVID-19, that speaks to things like vaccination and testing and therapeutics and prevention. So for vaccinations, they remain widely available to all residents. Mass vaccination clinics have been phased out, but we still have plenty of vaccination available, and it has already moved from these large vaccination centers to pharmacies, health centers, healthcare providers, and whatnot. So there's lots of vaccine out there, and we encourage people to go get their vaccines and make sure you get that first booster shot. That's really, really important. And for those who are eligible, we also suggest getting that second booster shot. Testing has shifted from temporary community testing sites to testing by health providers and at-home tests. There's still also a lot of testing available. There are community testing that's being done by the counties and through county providers, testing for schools via Operation ET and through Department of Health sponsored school testing. And Hawaii is participating in a bunch of federal programs that allow us to have access to testing as well. We also are transitioning a lot more to the over-the-counter home test kits, and those are pretty widely available. They can be mailed to your home for free from covidtests.gov. And over 500,000 test kits were already purchased and sent to the Department of Education to help keep students safe. And we have free test kits that were distributed to each county and to many community organizations. There are also 8 free over-the-counter tests that you can get per month. They're available using your health insurance, either for reimbursement or in some places, they'll just let you get the 8 without having to pay anything up front. Some health centers and community clinics, FQHCs, and long-term care facilities also are able to receive free tests and have been doing so. And testing is available at many pharmacies, clinics, and labs. So please visit the hawaiicovid19.com website for more information on testing and vaccination. That's hawaiicovid19.com. And then with regards to therapeutics, there are therapeutic COVID medicines that can be used to help treat those who are at high risk for severe illness. They're available by prescription throughout the state. They should be readily available to everybody who needs them. And we have a good supply and a good allocation right now in our state. These include monoclonal medications and antiviral pills. Contact your healthcare provider, or again, go to hawaiicovid19.com to find out where you can get these medications. Treatments do not replace vaccines, but they really can help for those who are at highest risk should they get infected with COVID. Case counts have climbed gradually for the past month nationwide and in Hawaii. Hawaii is still doing well overall. The number of hospitalizations is starting to increase over the past week, but hospitals still have lots of capacity to provide optimum care for these patients. What should you do if you test positive for COVID or if you're not feeling well? Well, first, as Governor said, stay home. We want you to stay home so you don't spread your germs. Stay home for at least 5 days. Stay away from others, especially those who are not vaccinated, and from our kupuna and those with health issues. If you can, do a home test and just kind of keep an eye on your symptoms. And if they're getting worse or you have any alarming symptoms, then by all means, go seek medical care. Avoid spreading your germs, I think, is probably one of the biggest things, and masks are a great tool to do that. It's really important that you wear your mask for an additional 5 days after you are out of isolation, because you may still be contagious. And make sure you let others know that you've been in contact with. Let them know that if you tested positive, or even if you're just not feeling well. We're also seeing some influenza now. So even if it's flu and not COVID, you should still let people know, and you can follow these same steps. If you are a kupuna or if you have health issues, please contact your healthcare provider right away to see whether you should receive COVID treatment. The treatment works really well, but it has to be started within the first 5 days. So if you start feeling sick, or if you test positive for COVID and you're at high risk, please contact your healthcare provider. Go to hawaiicovid19.com for more information on vaccination, on testing, and on treatment, and for a lot of guidance there on what to do if you test positive. Thank you.
Thank you very much, Dr. Charr. Dr. Sarah Campbell, our state epidemiologist, is up next.
Thank you. COVID infections are up nationwide, and they are up here in Hawaii. Our current daily average reported case count is 362, representing a 4-fold increase from a low of 88 cases per day on March 18th. As the Department of Health watches this trend, we feel the state is in a good position to manage and respond to the increase in COVID-19 infections, but we still urge the community to act with care. The increase in cases is something we expected to see as many of the restrictions throughout the state are being lifted, including safe travels and indoor mask mandates for public areas. People are returning to a greater state of normalcy, and so they're doing many of the things that they maybe haven't been doing during most of the pandemic. People are going to more events and larger gatherings. They're traveling. More people are returning to work in person. Variants may also be playing a role. So we are seeing the BA.2 variant make up a larger proportion of the circulating virus in our state. BA.2 appears to be more transmissible than the initial BA.1 Omicron variant. Also, as you know, there are many more COVID cases in the community than are reported to the Department of Health. This is because thousands and thousands of people are now taking home tests. The results of those tests are not included in our data. Because of all of these factors driving an increase in COVID-19 infections, we must maintain a level of caution. I want to point out that the cases we are seeing now are not so far associated with a dramatic increase in hospitalizations. We do have reasons to be hopeful that more cases does not have to mean a large burden of critical illness and death. When we look at the global landscape in countries where vaccination coverage has been high before the Omicron surge, even though cases shot up and hospitalizations also rose, ICU admissions and deaths did not show nearly the same level of increases during previous surges. We're talking about countries where the proportion of the total population fully vaccinated was around 85% and above, close to where we are only now in Hawaii. Also, while we unfortunately saw many hospitalizations and deaths due to COVID-19 during our Omicron surge in Hawaii, we can now expect that a more substantial proportion of our population has immunity from prior infection, in addition to the levels of vaccine-induced immunity we had going into the surge. So all that taken together, I would still caution, we've seen in every prior surge that hospitalizations are a lagging indicator. It's too soon to conclude that we are in the clear with respect to COVID-19. We must still use all of the available tools in our toolbox. So how do we help? Stay home when you're sick, get up to date on vaccinations and boosters, and be sensible about masking and other prevention measures, especially when attending large indoor gatherings. Masking remains a very important mitigation strategy in congregate settings, such as nursing homes, shelters, and schools. If you feel sick, stay home and get tested, either with an at-home test or contact your healthcare provider. And at anyone at high risk of severe illness from COVID-19 should talk to their physician about the COVID-19 treatments now available. We can protect our loved ones, our kupuna, and children too young to be vaccinated if we use the tools at our disposal. Thank you.
Thank you, Dr. Campbell. Keith Hayashi, DOE Superintendent, is our next speaker.
Good afternoon. Just as we are seeing in the broader community, case counts are also increasing in our schools. This marks the 5th straight week of increased case counts since spring break. A total of 396 confirmed or probable cases were reported across the public school system last week. We know we play an important role in the state's fight against COVID because our system is so large. We have 257 schools and more than 200,000 students and staff statewide. Because of the commitment of our staff, students, and families, we've been able to keep schools open for in-person learning this school year, and we want to finish the school year strong. We have less than a month to go. Part of that effort includes keeping universal indoor masking in place for the remaining 4 weeks of the school year. Under the Department of Health's guidance for K-12 schools, keeping this added protection in place means quarantining of in-school exposures is no longer required. This major shift in quarantine guidance aligns with our ongoing priority of maintaining in-person learning for our students. As much as we all want to return to pre-COVID practices like Dr. Kimball, Dr. Charr, and Governor Ige said, we are still in a pandemic and we must act accordingly. Graduation ceremonies are coming up in the next few weeks. We want to be sure that our students can celebrate this special occasion that they deserve, but it has to be done safely. We've provided overarching guidance and safety parameters for schools to use when planning their ceremonies. There are different considerations for different venues. Schools have the flexibility to determine event-specific details to maintain the health and safety of all attendees. So we ask for everyone's help to please be mindful and respectful of the safety procedures that schools are putting in place to ensure that our graduations do not create an added risk of exposure and spread of the virus. Participating in graduation ceremonies is a privilege and one that definitely we want our students to enjoy and remember. To help with this effort, we have received 700,000 home test kits in partnership with the Department of Health. Over the last 3 weeks, we have distributed nearly 400,000 kits to our schools. We appreciate our close partnership and guidance from DOH and the ongoing support from the governor's office, our mayors, and other partners and stakeholders. We will be meeting with DOH to determine safety protocols for summer school and next school year, and we'll make those announcements when appropriate. Thank you.
Mr. Hayashi, now with that, we'll open it up to questions from the media. So in-house, if you have any questions, please step up to this microphone. Anybody online? I'll go first to Rick Daysog. Was that your hand?
That's me. Question on resources. What is the status of our unspent CARES Act money, and when will some of that lapse? I ask that because it looks like a lot of this transition strategy is, a lot of it has to do with free testing, free vaccination. When is that going to lapse? When are we not, going to have to pay for it ourselves when we go back where COVID becomes more of a normal part of our society?
Thanks for that question, Rick. We do have a team in Budget and Finance that is monitoring all of the CARES Act funds. We were able to spend all of the initial funds that we received that had to be spent last year. We continue to monitor and take appropriate action as we pursue. I can assure you we will spend all federal funds again as we make it through the year. As you know, there were several appropriation requests for CARES funds that is in our budget that is currently being decided by the legislature. We will continue to use my authority to spend other federal funds so that we can meet the needs of our communities.
Okay, thank you very much. I think Rick had a follow-up. Go ahead, Rick.
Oh, sort of a follow-up on top of that was that, in the transition period, it sounds like from what we heard, free testing, free vaccination is a key part of that strategy. How long do you think that'll last? I mean, when is it going to be a point where we're going to have to use our insurance to pay for it or out of pocket?
The White House has informed us that they are running out of funds, and they've made it clear that when the funds are exhausted, then we will have to go to the normal way of covering health costs. We don't have a specific timetable for that, Rick. We do know that the federal government is scaling back on support. And so, we are anticipating that. Our budget request to the legislature did anticipate that we would have to be spending other funds to support our community. We do know that it's important that we can administer vaccines, that we can continue testing as we transition to disease management of COVID.
Thank you very much, Governor. Going now to Bryce Moore from KHON2. Bryce?
Cool. Thank you. This one can be for you, Governor. Thanks. So you mentioned we're transitioning out of pandemic response and into more public health management. Why wasn't that the case 4 weeks ago when the indoor mask mandate was lifted, especially now because there's more cases than at that time? What changed?
Well, clearly, we did anticipate that as we dropped the requirements, that we would see more cases. As you know, we had anticipated spring break would encourage travel and we would see more cases. So what we are seeing today and the fact that the last 5 weeks, we've seen increasing case counts, we did anticipate. We continue to monitor COVID cases in the hospital. And although they have increased, it's not at levels that would be alarming. So we do feel like we have sufficient capacity in the healthcare system to deal with the increasing cases.
Is there a threshold that you're anticipating? So what would be too much?
No, I mean, it is a complex situation that we look at. We continue to monitor the infection rates, what the census is in our hospitals. And then clearly the department is looking at following up on infections and especially in the priority areas. And certainly Dr. Charr will be more specific.
Thank you, Governor. But just to clarify on that last question, it had always been the plan to transition. We knew we couldn't remain in emergency response forever. And so as things change with the federal government and with the emergency status, we had always been planning that at some point we would need to transition. And so we had been planning this for at least 2 or 3 months now.
Okay. But we were under 100 cases a day. So why is the transition now when we're back up into hundreds of cases?
Well, as noted, I mean, we had started the transition a couple of months ago. Cases were still coming down from Omicron, but we were already starting the transition and planning the transition. And I think it's just sort of been captured by everybody in the public, realizing that we're in this transition now, but we had been in the process of transitioning for a couple of months already.
Thank you, Dr. Charr. Moving on to Esme Infante, Star Advertiser. Esme?
Hi, all right. I have a question that either the superintendent or Department of Health can, our good folks from the Department of Health can answer. My question is about rules that have been set for proms as well as graduations. And, we had a couple of schools in the news recently regarding lay giving and so forth. I know those 2 schools have since reconsidered, but my overarching question is, does the DOE feel it is appropriate for schools? I know they have the flexibility. Is it appropriate for them to go beyond in terms of being stricter than the guidance that DOH and CDC has issued? For example, requiring vaccines and negative tests to get into these events, or saying no physical contact while dancing. These are actual things that have appeared on some of the rules from some of the schools. So, does the DOE endorse this? Does DOH endorse going beyond the current guidance?
Thank you very much for the question. As we shared, the department provides overarching guidance for our schools to determine what is acceptable. And schools then would design their specific requirements based on considering health and safety issues for our students, which is most important. So while we provide the overarching guidance, schools are left to also design those specific guidance for those respective events.
Did the Department of Health want to add anything? Okay, Dr. Kemble. Esme, I'll get to your follow-up in a second.
I'll just add that from the Department of Health's perspective, we also want to make sure that schools have the flexibility to institute policies that are going to be feasible and practical for them to implement, and that ensure the safety of their students and staff. So from a health perspective, large events that are going to involve people coming in from off campus are always going to be higher risk in the setting of COVID-19. So taking extra precautions around those events makes sense. The schools can make those decisions about how to best implement that.
Thank you very much, Dr. Kemble. And the governor?
Esme, I would just also add, just as a practical matter, when I review invitations and we are making decisions about events that I go to or participate in, we do as a routine ask about safety protocols that would be instituted. Obviously, if a function is requiring vaccinations and proof of vaccinations or testing, it does provide us some insight about what we expect to see at the event itself. And clearly, those events that are implementing and continue to implement, even though it's not mandatory, vaccination checking and testing certainly presents a more appealing event profile that would facilitate our attendance or not. So.
Thank you very much, Governor. Esme, you have a follow-up?
I do. Thank you. This is also regarding schools. Since we are transitioning into a, as you say, kind of a more a public health management kind of a model, is there plans for better, or I guess more stringent monitoring of air quality inside of the classrooms, and or plans to improve the quality of the air in the classrooms? Do the teachers feel safe that way?
Thank you very much for the question. Our Department of Facilities and Operation continues to monitor and provide guidance to schools. We continue to encourage schools to open windows. We do have different strategies that we have in place through our Office of Facilities and Operation in supporting schools and in monitoring air quality.
Okay.
Thank you.
All right. Thank you very much. Moving on to Paul Drews, KITV4. Go ahead, Paul.
And this is probably a question for Department of Health. It sounds like we're at that post-pandemic phase, or we're out of the pandemic now. So I just wanted to find out, it sounds like we're going to be treating this more like how we treat, say, the flu in the islands. I wanted to ask about staffing. We have all those contract tracers, all the people that have been involved with COVID. What happens with all of that?
So we are still in the pandemic. We are not in an endemic phase yet, as noted by our numbers going up again. So we are very much still in a pandemic phase. That being said, our response to it, I mean, it's not sustainable to do the level of emergency response that we had been doing for the past, 2 years now. And so we knew we had to transition at some point, especially as the public is more aware and there are more things in place in the healthcare system. So while we are transitioning, we are still very much in a pandemic. We have a lot of personnel, they're still working. We've taken some people and had shifted them off of their primary line of work to assist with the pandemic. So some of those are going back a little bit more towards what they normally do. And I think Dr. Campbell probably has a better capture on all the specifics with regard to things like contact tracers, but still a lot of work to be done.
Dr. Campbell?
Even still being in an active phase of pandemic response, there are some shifts that have taken place over the past few months, and these have been also discussed at the national level as well. One is realizing that with an airborne disease like COVID-19, that's a common respiratory pathogen, contact tracing, universal case investigation and contact tracing is not the best method to control that disease. And so we've seen a shift from trying to track down every single case and follow up all of their contacts to instead getting the message out so that we all have our own personal COVID-19 preparedness plan. We know what to do. We now have access to testing that we can do in the comfort of our own home. So we can take that, that response element into our own homes. We can see when we're positive and we can know what to do. And so that's really our key now, is to make sure that people know what to do when they test positive. That's staying home when you're sick, getting tested. And if you test positive, that you're observing that isolation period and you're telling your contacts about their potential exposure so they can also take precautions.
Thank you, Dr. Campbell. Go
Sorry,
ahead.
follow up on that. So what is the benchmark for us being out of this pandemic? We saw the numbers drop and then they pick back up again. How low do they have to be until we say, okay, we're done?
When we talk about pandemic, to me, that means global, uncontrolled transmission of a disease. And in that sense, we are still very much in it. We're still seeing ongoing global, uncontrolled transmission of COVID-19, and we're still seeing emergence of yet new variant strains. So I would say we're still in that period of uncertainty. In a way, transition into endemicity defines itself by being the state where we no longer have crisis situations due to the disease. It's hard for us to know that because COVID has surprised us at every turn. So when we begin to see, let's say we get through another respiratory disease season, a winter respiratory disease season, and we don't see a major hit on the hospitals, we don't see a dramatic rise in deaths, that is the transition into endemicity. I wish I had a magic answer to say exactly when that happens, but the real answer is when we no longer see that emergent state happening, that's when we're endemic.
Thank you very much.
Sorry,
Go
just for
ahead.
clarification, the respiratory season, that's in the winter time. So you're
Correct.
talking at least another year we'll be in this pandemic.
I think realistically, we're looking at a pretty long time frame to really understand the impacts of where we're at now of immunity so far and how that's going to help us through the next season.
Okay, moving on to our Mike Brestovansky with Hawaii Tribune Herald. Go ahead, Mike.
Hi, this would be for one of the doctors. You mentioned earlier that BA2, the BA2 variant is the, I guess, growing in prominence or the dominant one on the island in the state. I was wondering if you have any numbers or percentages on that.
Dr. Charr will take that question.
The virus is always mutating. It's kind of constantly mutating. And I think the last check nationally was that between BA.2 and BA.2 subvariants of I think it's the BA.2.12.1, those together make up about 98% of the virus that's out there right now. In Hawaii, right now we're sitting at 70%, and I expect that will go up. We should be coming out with another variant report in the next few days. And I'm guessing that our numbers will go up as well. We've sort of been mirroring what we're seeing on the mainland.
Right. Thank you very much, Dr. Charr. Moving on to Zoe Dim from Hawaii Public Radio. Go ahead, Zoe.
My question is for DOH. How is the department monitoring cases from the recent cruise ship that had an outbreak and left for San Francisco?
Dr. Kimball taking that question.
With the cruising industry resuming again and coming to the islands, there's been a long process of many months to get ready for that. So there are memorandums of agreement in place with the various cruise lines that are coming to Hawaii ports. And that includes, clauses to make sure that the companies are going to be responsible for tracking cases on board, reporting them to us, and also taking care of accommodations and needs for isolation and medical transport should they arise. One component of the resumption of cruising is that many of the cruise lines are actually instituting very high bars for vaccination and testing before people come aboard. So we're seeing a very different situation than we did in 2020, when a cluster aboard a cruise ship almost invariably meant medical transports, multiple medical transports to hospitals, sometimes deaths, and very tragic situations. This year, we are still seeing cases detected aboard cruise lines, but we are not seeing the same degree of medical need related to those cases. And I think a lot of that's attributable to the high vaccination coverage rates on board.
Thank you, Dr. Kimball. You okay? All right. All right. Moving on to Joel Lau, Civil Beat. Joel.
So this morning, Dr. Anthony Fauci made headlines saying that we are out of the pandemic phase. And you mentioned, Dr. Charr just mentioned that we're still in the pandemic. So I guess my question is, would you disagree with Fauci's assessment that we're exiting the pandemic phase? And if so, are we out past the worst?
Dr. Kimball taking that question.
I'm reading the same headlines that you are, but I do see that, if you look more closely at the context in which those statements were made, I think the intent was that we may be entering a new phase of the pandemic in which we see some dissociation of the number of cases from the severity of outcomes that we see. I would agree with that. I think we are beginning to see some changes in what it means to have a COVID infection and how much of a burden that's placing on society. At the same time, I wouldn't say that we're out of the pandemic, as I was just discussing.
I had a question. So testing has remained at low levels, and we mentioned that we're exiting out of the mass testing campaign that we had over the past couple of years. However, positivity rates have skyrocketed. I think we're about 9% overall in Hawaii as of today, and in Kauai we reached 17%, although out of very little tests conducted on Kauai. Is that worrying to you? Are we worried that, you mentioned 300 something cases? Are we worried that those are inaccurate measurements?
So I would actually say that testing has not decreased. In fact, my assessment is testing has increased quite a bit. The type of testing has changed. So we're no longer seeing as much testing by PCR. Most of that is going to be reserved for people that ended up needing healthcare attention. And that's where we're seeing the PCR testing still happening. But for those who are out in the community, don't need to go into an ER or to the hospital, many people are doing home tests now. Now, those numbers don't translate into our data dashboards because we don't receive those numbers. So I was saying the case counts that I quoted to you today in the 300s for the daily average, that is an underestimate of true infection. There are far more infections than that happening every day in Hawaii right now. And that is why we have to shift the metrics that we're paying attention to now. Case counts are important because they are a preliminary indicator, as is percent positivity. But we also really have to pay attention to how much critical illness are we seeing? What are the ultimate count in deaths? Now, this is challenging because those are late indicators. So we have to watch all of the signals and try to integrate those as best we can to make decisions.
Thank you very much, Dr. Campbell. Going on to Bryce Moore, KHON.
Yeah, so kind of the same thread. We were just talking about underreporting of cases. But at the same time, I know you said it's a lagging factor, but there's no one in ICUs here locally. How do you reconcile that? Is COVID getting less severe?
I really do think it's still too soon to make that judgment. In the past, we've seen first an increase in hospitalizations, which we are in fact seeing now, followed by an increase in ICU admissions, which we haven't seen yet. So I feel like in 2 to 3 weeks, we'll have a better sense of whether the other shoe is going to drop or if we are really seeing a flatter curve for severe critical illness, which, I would certainly hope for that, but it's too soon to say.
And then, of course, we're still obviously reporting deaths. What can you tell us about people who are still dying? Are they vaccinated? Are they boosted? Do you have any information about that?
I don't have numbers for you in terms of the proportion of deaths that are breakthrough deaths at this moment. And it's something that we continue to try to look at. We still are working to build a direct connection between our Hawaii immunization registry and our case data so that we could ultimately answer these types of questions much more effectively. This is one of the core information infrastructure needs that public health really is important to actually maintain the capacity of public health to answer those kinds of questions in real time. So among many other things, one of the lessons learned in this pandemic has been the importance of building and maintaining that infrastructure from the get-go so that we would be able to have that kind of information at our fingertips when the need arises.
Thank you very much, Dr. Campbell. I believe Dr. Charr has something to add.
One other thing to bear in mind relating to your question is that early in the pandemic, when you got sick, we didn't have any treatment and we didn't have any way to prevent it with regards to vaccines and things. And right now we have vaccines that are very effective. We're learning more every month in terms of efficacy and how best to treat things. We have a whole bunch more medications, both monoclonal antibodies as well as antivirals that we can use to treat people to help prevent them from getting to the point where they need to be in the hospital. And then we also have treatments once somebody is hospitalized. And so I think all of those things taken in context are helping so that when you get COVID, it's vastly different than had you gotten COVID right in the beginning of the pandemic.
And then last question about deaths. The most recent data from the dashboard, I believe it was on the 18th of April, it showed 8 deaths. 2 of those were under 30 years old and only 1 of them was over 80. Do you have a reaction to that?
Well, I mean, it's sad anytime anybody dies, especially related to COVID. But I think there are so many factors that surround an individual situation. So I'm not really in a situation to speak to that right now.
Okay, moving on. Thank you, Dr. Charr. Moving on to Esme Infante, Star Advertiser. Go ahead.
Oh, thank you very much. I did hear Dr. Kemble, addressing, the dissociation between case counts and hospitalizations. I know hospitalizations are a lagging factor, but there must be some projections for hospitalizations in the coming weeks and months. And we're just wondering, are hospitals preparing for a potential surge in patients, and are you concerned about the numbers?
Dr. Charr, heading to the podium.
So I think I may be better able to answer that. So the hospitals are doing a good job through the Healthcare Association. They're always preparing. They do have plans for, surge plans, whether it's for COVID or anything else. I think that's why we're really seeing a shift now, and we're encouraging people, if you get sick and if you're in that high-risk population, please get some treatment, get some of those therapeutic medications, because that will really help to keep you from having to, progress to something where you need hospitalization. So we have other things that are very helpful. Vaccination, absolutely. We're strongly recommending people go get vaccinated. We know that helps to prevent people from progressing to becoming severely ill and needing hospitalization. But really the therapeutics, we're trying to get the word out. The Healthcare Association has it on their website. We have it on our website, the hawaiicovid19.com. that you can go to that website and see where the therapeutics are available. It's widely available across the state with a prescription.
Thank you, Dr. Charr. Esme, did you have a follow-up?
I do. I totally hear Dr. Charr on the preventive measures. I guess what I'm specifically asking is about numbers, projections for hospitalizations, given that, as for example, Superintendent mentioned the past 5 weeks, cases have ticked up consistently. For statewide, do we have projection actual numbers for hospitalizations in the coming weeks and months?
So I don't know how many people will end up in the hospital. A few weeks ago, there were about 25 people in the hospital statewide. Right now, we're about 50-ish. And again, if we can get therapeutics to people in a timely fashion, when they get a COVID infection, it can help to keep them out of the hospital. So I don't know where the numbers will go. It's anticipated, because hospitalization is a lagging indicator, that as we see cases climb, there will be a rise in hospitalization. But how well that correlates, I don't know. The good news is that it correlates less well than it used to. So more people can avoid hospitalization even though they get COVID.
Thank you very much, Dr. Charr. Moving on to Paul Drews, KITV. Go ahead.
Governor, you had mentioned earlier there wasn't going to be any new mask mandates, but there are still some requirements, whether it's vaccine requirements for employment for people, or even like here at the Capitol, it's closed to the public for them to come in. What will it take for those things to drop?
I think as we are transitioning, every business, every organization will continue to look at public health guidance and make decisions about what risks they see and what kinds of precaution needs to happen. We continue to advocate that everyone should have a layered structure of activities to reduce the spread of COVID. It's like at the Capitol did reopen. They did require masks to be in the public hearing rooms because of the numbers that might be involved. So again, I think every business and every organization needs to look at what kinds of activities they have. Part of it is, and I think part of the lessons of COVID-19 is about, how do you structure your work? You want to keep your work teams intact and exposed to constantly the same people. That helps us to reduce the spread of COVID-19. So I do think that we are asking everyone to take the lessons that they've learned. I think we know what works in slowing the spread of COVID, and people should take the precautions. I certainly would encourage people who are having meetings, especially when you have meetings with people coming from different states or different countries, that it would be smart for them to require vaccinations and testing on site.
Thank you very much, Governor. Go ahead.
Sorry, I guess I'm just wondering, many people are just wondering, when are we going to return to, what will it take for it to, everything to return to normal? I know when this had all started or the pandemic had begun, they had said once we get to 75 or 80% herd immunity, then we'd be able to relax things. And that wasn't the case. So that's why we're just wondering, do you have anything in your mind like, okay, when it gets to a certain point, I'd like to see it get to this, and then it'll be back to where we
I mean, I don't think that it's as simple as that. It's certainly a complex question that we keep asking. It does make sense to wear a mask indoors, especially if it's dealing with many people going to an event. We're not going to mandate that occur, but certainly businesses and organizations will have to make that determination. We don't have a specific target in mind when we think that they don't have to take precautions. I continue to wear masks in meeting with people indoors, face to face. We still are using virtual meetings and those kinds of protocols because it continues to keep us safe and slow the spread of the virus.
Thank you very much, Governor. Okay, going to Rick Daysog, H&M. Go ahead, Rick.
There's a question for Governor also. And it's more, I'm sort of more asking for his reflections. It's been a long 2 years. A lot of things have happened. Are you surprised it's taken this long to get to this transition period? Or are you surprised that we've gotten here really quickly comparatively?
No, I mean, I think we are all surprised about how the pandemic has occurred. I do remember in the very early days, if you look back to March, April, May of 2020, we definitely did not know whether we would have a vaccine. And certainly we had very few therapeutics and drugs to treat those with COVID versus today where we have both effective vaccines as well as therapeutics and treatments. So I do think that in any kind of public health emergency, we would expect that it would be changing as we learn more about the situation as we develop better treatments. We do see how quickly the vaccine was developed, and certainly that was unusual. Certainly the resources that the federal government was to apply to the development of vaccines and the development of treatments and then distribution of the treatments significantly impacted the pandemic, and we are benefiting from that today. And that's the concern about the lack of additional funding provided to the COVID response on a federal basis. The federal government, by ordering vaccines to be able to be distributed, allowed the manufacturers to increase capacity. The federal government ordering treatments and therapeutics once they were approved allowed those pharmaceutical companies to expand their capacity to produce the medications. With the lack of funding, all of those things will be going back to normal business. And that would mean that the development of treatments would slow down. The development of vaccines for mutations and those kinds of things would also be slowing down without additional federal support.
Great, thank you very much, Governor. We have time for one more question. Bryce?
Yeah, so this one's for either the Department of Health or the superintendent about masks in schools. I'm using numbers from the Disease Outbreak Control Division website. It says that there's been less than 5 deaths in kids under the age of 17 in Hawaii since the pandemic started. So I guess my question is, why are they the only ones with such a broad mask mandate?
Dr. Kemble will take the question.
When we think about the value of slowing the spread of COVID-19 in schools, it's not purely to prevent deaths in children. Remember too, that most children who are infected are infected at home. And they're often having that impact and the severe outcomes that they have due to transmission, not necessarily in school settings. However, there are many ways in which a child's experience is severely disrupted by COVID-19 in school settings without some level of control. And part of that is that children don't exist in a vacuum. They're part of households, they're part of families, they have siblings, they have grandparents. And a child can be a vector for COVID-19. I think at the very beginning of the pandemic, we wondered if they could be, and maybe they were protected against it because of their immune system and they wouldn't have this impact. But we then soon learned that in fact, children can be very effective vectors of COVID-19 and they can transmit it to their households and their grandparents. And we have tragically seen deaths through household transmission of COVID-19 from a child to a grandparent who died. And that's absolutely a situation we would like to avoid. There's also disruption in schools when you have a lot of kids out sick, even if they aren't severely ill, they're missing school. And because of the isolation and quarantine requirements, they're missing quite a bit of school. If you have a large household with siblings, they might be out of school for a month because of extended quarantine requirements. So I think when you look at that global picture and the value of in-person learning, you have to consider that whole picture and considering what's the best decision to control spread of COVID-19 in our schools, but also for the community at large.
Thank you, Dr. Campbell. Keith, did you have anything to add? Okay. Keith Hayashi, dairy.
Thank you. We've been working very closely with the Department of Health and in working with our schools. And as Dr. Campbell has shared, it's so important for us to keep our students in school, in person learning. And so through their guidance, we're able to do that. And 4 weeks left, we're going to continue to implement the indoor masking, universal masking indoors. And we're looking forward to a very successful closing to our school years. Thank you.
Thank you very much. And with that, Governor, closing remarks.
Thank you for joining us here this afternoon. Just really wanted to emphasize that COVID-19 isn't going away, and we are transitioning from emergency response to disease management. And we all know what we need to do to slow the spread of COVID. It is about getting vaccinated and get up to date. If you're eligible for a booster, that has tremendous impact on keeping you healthy and safe. If you're sick or symptomatic, stay home and isolate. Get tested. At-home tests are accurate and available. We do know that when we do all of these things, we can slow the spread of COVID-19 and get back to the new normal. So just really want to express my appreciation to all the people of Hawaii. We continue to work to reduce spread of COVID. And I think most importantly, take the actions that can help us keep our community healthy and safe, restore our economy, and really get back to managing this disease in the best way possible. Thank you.